Welcome to Indian Indian News. Our guest today is Suraja Menon Roychowdhury. She is one of our 10 outstanding women of the year 2025. On March 8, she will be honored at our 22nd annual Women of the Year Awards Gala. We are going to talk to her unique journey.
I'm a Chinese medicine practitioner. I have my practice in Lexington, Crossing Point Acupuncture and Chinese Herbal Medicine. And I believe this is an excellent treatment modality for people who have acute and chronic conditions. And I have a PhD in pharmacology. I actually did my undergraduation and master's from All India Institute of Medical Sciences in Delhi and a PhD from University of Illinois. I also have an MBA from the University of Cincinnati. And I have worked in the pharmaceutical industry for about 9 or 10 years, first at Eli Lilly and then at GlaxoSmithKline, before I went into this journey of being a Chinese medicine practitioner. I do volunteer as an advisory board member for VisionAid, an organization that helps to educate, enable, and empower the visually impaired in India. I also have worked as a judge for the India International Film Festival of Boston for the last 7 years. And finally, I'm a poet and I volunteer as an editor for Haiku Katha magazine, which is an offshoot of Triveni, and teach advanced poetry, haiku poetry at allpoetry.com. What drives me, I think, is just my curiosity and interest in people and situations around me and in just learning new stuff. It doesn't matter what it is. If it's something fun, I enjoy it.
Surya, welcome to our studio.
Thank you so much, Pedra. Thank you for having me.
Excellent. And we are looking forward to honoring you on March 8th.
Thank you.
This is the first time I'm interviewing somebody who is a non-MD physician.
That's right.
And then alternative medicine, what at least a lot of people know. Mm-hmm. It has really picked up a lot of momentum here in the US. Right. People want to try some different things.
Right.
And since you are expert in this area, so let's first start with what you do.
Okay.
Sure.
So I started, this is my second career actually. So I'm a pharmacologist by training and I worked in the pharma industry for about 10 years as a clinical neuroscientist. And in 2011, I went to acupuncture school, Chinese medicine school here in Boston. And 3.5 years later, I was a licensed acupuncturist and I have my own practice in Lexington. It's called Crossing Point Acupuncture and Chinese Herbal Medicine. And I offer acupuncture treatments as well as herbal medicine treatments, all within the framework of the physiology of Chinese medicine and, the diagnostic principles and treatment principles. So it's been a very interesting journey because, I came from a science background, very firmly rooted in human biology sciences, and then moving into this field where the whole concept is completely different. You think more globally. Treatments are always very individualized for the patient. So, we try to understand each patient as an individual versus these are all the people with headache and we are going to treat headache with one medication. So personalized medicine really at its best, but it's rooted in like 3,000 years of observation, culture, and history.
So we will get into this in much more detail.
Okay.
But let's first clarify as far as the nomenclature is concerned. We call it alternative medicine. At least it was called a few years ago.
Right.
Now it is called, as you said, complementary medicine.
That's right. So we prefer the term complementary medicine because when you say alternative medicine, it makes you feel like there is one mainstream medicine and everything else is an alternate that you're trying. But actually, if you think about it, these medications, these forms of medicine like Chinese medicine, Ayurveda have been around for actually 2,000-3,000 years. So they really are more mainstream than Western medicine, which is really a new guy on the block right now. So complementary medicine, because we believe that treating a patient you should use all the modalities that are available, not just one type of medicine, one type of approach. So you can treat a person with medications, but you can also treat them with, lifestyle modification. You can treat them with acupuncture. You can treat them with a whole host of things. So I like to think of all of these medicines as being complementary to each other, with the patient's interest being at the center of everything.
And who is a typical patient of yours?
So the typical patient that I see is somebody who has had a chronic condition. So, if you think about it, when you have some kind of illness, you're not going to go to Chinese medicine or Ayurveda first. You're going to go to Western medicine. And then you try all the treatments that are available there. And then when nothing works or you're not satisfied with your treatment, then you seek out alternatives. And then you come to, then patients come to me. So I see a lot of patients with chronic pain. So, and pain from different conditions, it could be musculoskeletal pain. So it could be shoulder pain, neck pain, knee pain, back pain, any of those things. It could be headaches, it could be any kind of headache. So it could be headaches from menstrual pain. It could be cluster headaches. It could be any variety of migraines. So those are the most common people that I see, people who have pain from any sort of diagnosis.
And what is the core fundamental principles of Chinese medicine?
So the fundamental principle of Chinese medicine is that we are in equilibrium with our environment. So we are a part of this environment, we are in equilibrium with it. And when we are not in equilibrium and that is disrupted in some way, so we have energy that's running through our body that comes from the food that we eat, the sun that falls on us, these are all forms of energy that the body then takes and transduces to make life happen. So when there is some interruption in the process of that energy moving through your body, transferring, then you have symptoms. And ultimately, the symptom that you see is a result of an imbalance somewhere in the body. And we try to figure out what that imbalance is. And then we treat that imbalance. And when that imbalance is treated, not only does your primary complaint start getting resolved, but a lot of other things that you didn't think about. Say you came to me for pain, but you never mentioned that you were not sleeping well. You probably didn't even think about it. Or, you were not having, your mood was bad or your bowel movements were off. But all of these things, if you address the core issue that's going on, they get resolved. So this is the basic principle of Chinese medicine, is that it's a holistic medicine and it looks at the patient as a whole, and we try to address the root cause of whatever the issue is.
And now talk also a little bit about acupuncture, how that works.
Okay.
It is part of the Chinese medicine.
That's correct. Correct. So Chinese medicine is an umbrella term. There are, five pieces to it.
And what are those 5 pieces?
So, food is medicine. So diet is very important. Exercise is very important. Herbal medicine, then acupuncture, and then, meditation or like mind-body work, like Tai Chi, Qigong, these kinds of things.
So, Surya, tell us about the acupuncture part of the Chinese medicine.
Okay. So acupuncture basically is the insertion of very fine needles into the body, into certain points in the body where we believe we can access this innate energy that exists. And it's a very powerful thing if you think about it, because these needles, they are not coated with any medication. We are not injecting any medicine, nothing. We are recruiting the body's own ability to heal itself. And that is a very, very powerful thing if you think about it. So a lot of people will, say that acupuncture, the effect is a placebo response, and they dismiss it. But if you think about it, a placebo is the body's ability to heal itself. And imagine the power that resides within our own bodies, that you have it to heal yourself. You don't need to take medication or anything like that. The innate ability to heal exists. And that is what acupuncture taps into.
So now, Surya, those of us who come from India in this background, of course, we have heard the name of Ayurveda in India.
Yes.
And, as a child, many of us have probably tried something with Ayurvedic. So if you can try to explain the difference between Ayurveda and Chinese medicine, if you are familiar with this, if not.
I'm really not familiar with Ayurveda at all, Upendra. Unfortunately, I think our Indian medical system doesn't expose us to anything that is indigenous. So we've studied all Western medicine, and I know nothing about Ayurveda, except that there's a lot of herbal remedies that are there. There are marma points, diet as medicine, but which are all, similar concepts to Chinese medicine. But as far as a comparison, I cannot tell you. Yeah.
So now let's come back to what made you transition from being a scientist and pharmacologist to Chinese medicine.
So I'm glad you asked me that question, because it's been an incredible journey for me, not only, professionally, but also personally. So we moved to Boston in 2010, and I had no intention of changing my career from being a clinical neuroscientist. But at the time, I had decided to take a career break for about a year to make sure my son settles into college and, things with moving and all that. So at that time, a friend of mine who's a physician turned acupuncturist, her name is Dr. Kalpana Patankar. She suggested to me that I try acupuncture and Chinese medicine as a career. And she said, Suraja, it's like raga music, like you have a framework, but within that, you're free to improvise. So why don't you do it? And she said, the New England School of Acupuncture in Boston is an excellent school, so you should try it. So I enrolled, and to cut a long story short, I did not enjoy it at the beginning at all, because it was so different from Western medicine. But one of the good things that the school used to do is have us follow practitioners in the community. So we see how they treat their patients and how they run their practices. And that's where I saw that, a lot of people who come for acupuncture come for chronic conditions. Like I mentioned earlier, people don't come to acupuncture for the first time that they fall sick. And then I was seeing all these chronic conditions getting resolved. And then, I stuck with it. And 2.5 years later, I became an intern. And I was told how to diagnose a patient within the Chinese medicine framework. And if you diagnose it correctly, this is the way you treat it. And so I did. And even though I felt like I knew nothing, my patients started getting better. So it's a very powerful system. So that's where I changed my...
So roughly, is there any number, like how many points in the body are where you can put the needle, or it's just a guesswork?
No. So there are about 360 acupuncture points, and there are several more extra points, and they are all very firmly rooted in anatomy. So you can't just stick a needle anywhere. So, we have different channels that we talk about. The channels have, specific anatomical landmarks. And there are the points where you put in there specifically, they're like, for instance, there's a point here on your wrist, or, there's a point here. So these are all specific points that you address. And each of the points has a function to it as well. So you can't just randomly stick needles in anywhere.
And approximately how many points you can needle at one time? Is there a limit? Or?
There's no limit, but we try to limit our treatments to as few or as many needles that are needed. So I'd say anywhere between 10 to 20 point needles bilaterally, so on both sides of the body, we would use.
So a typical patient comes to you and you start the treatment. How long it roughly takes? Half an hour, 1 hour?
Yeah. So if I have a new patient, so the very important thing about Chinese medicine is listening. So we, take about half an hour to talk to the patient. They will tell us their symptoms and everything. And while they're telling us the symptoms, I'm listening to their tone of their voice. Like, do they have a sing-song voice, or do they have a deep voice, or, do they have a breathy voice? So all of these things give us, insights into what the patient's talking about. Once I get a full history of their body, not just their symptom, but everything else, then I will come at a diagnosis, and then I'll put in the acupuncture needles and let them rest for about half an hour. So the new patient probably takes an hour and a half. Return patients, because we don't need to take the long history, they'll probably like about 45 minutes to an hour.
And while they are in your clinic, what they are doing? They are sitting there.
Yeah, they lie down, they get the needles in. Sometimes while I'm needling them, they fall asleep. Sometimes they will wait until I'm done, and then they'll rest, they relax. Mostly people are very relaxed because...
I wish I had asked you to come with some needles today. We could have done a live...
Absolutely.
And next time we will do that. Yeah?
Absolutely.
Yeah, excellent. Now, so we are talking about the transition. So where did you work as a scientist, and how long did you work?
So my initial, after my PhD, I did my postdoc at UC San Francisco. And then after that, I did not like lab work. Actually, I got very allergic to animals. So I went back to school and I got an MBA. And so I was at that time, one of these unique people who had a PhD and an MBA. So with that, I got a job at Eli Lilly and Company in Indianapolis. And I worked there for 5 years. Then we moved to Philadelphia and I worked for GlaxoSmithKline for 6 years. And then, 5 or 6 years, yeah. And then GSK decided to get out of the psychiatry arena, which is where I was working. So we were all laid off. And it worked out at the same time my husband accepted a job here in Boston. So then
and your husband is also a physician?
My husband is an oncologist, yes.
Okay.
And he has his own personal biotech firm. I mean, he's a partner.
Mm-hmm.
So, yeah.
Okay. And so now also you got involved with Vision Aid as well. You have been volunteering for them, working for them. So tell about how that happened.
So that was actually interesting. And actually it is because of Woman of the Year, I think, that happened. So Woman of the Year 2019 was Revathi Ramakrishnan.
Sure.
And she came to me the day after the event with a lot of knee pain. And I can share this because she has shared it widely herself.
Sure.
So I'm not, breaking any HIPAA rules
here.
Okay. Yeah. Okay. So she came with a lot of pain and, I was able to help her. And then she told me about, all her work with Vision Aid and all that. And I was very impressed. So I told my husband about it. And at the same time, too, one of my interests in Chinese medicine is treating visual degenerative disorders.
Okay.
So this is, these are a whole set of conditions where there are not very good medications available. And, you get vision loss, people with diabetes, their vision starts degenerating. So I have tried to get a specialization in that area. And Vision Aid seemed to really, the work they were doing.
They're doing a great job.
They're doing a great job, yeah. So I got involved, we first donated to Vision Aid and then Revathi invited me to be on the board as an advisory board member. So basically I've been on that board for about 5 or 6 years now. I don't do a lot of hands-on work. My work is, I've done more of recruiting people into the group to become donors, to come and attend the programs, things like that. There's also a very interesting app that they introduced us to called Be My Eyes. Mm-hmm. So basically anywhere around the world, any person who needs help can call on that number and, they will be in a supermarket and they'll say, okay, what am I looking at right now? And I can tell them what they're looking at. Mm-hmm. So things like that. And, it gives me a better understanding of all the work that goes into rehabilitating people, bringing up to the point where, they can speak excellent English in 6 months from speaking only Telugu. It's amazing.
Sure.
So, yeah.
And what do you do for fun?
What do I do for fun? I do a lot of things for fun.
Okay. Let's go one by one. Yeah.
Okay. One of the things I love is Hindustani classical music. Mm-hmm. So I've been training on and off, for many years. Currently it's off, but it's one of my big passions. So I'm a very enthusiastic supporter of LearnQuest, of Shadaj, all of these organizations. I also love to write poetry. So Japanese short form poetry. So this is another gift that Boston has given me. I took a class in the library of how to write haiku. And so
haiku, I have heard the name, but I don't know what exactly it is.
So it's a very short poem. It's a 3-line poem. And it basically is, makes you very aware of the moment. So you see something in the moment and you capture that. So you have, an impression. It's we call it an unfinished story. So you see something, you engage with it in that moment and you try to have allusions to the time of the day or the season, anything in nature. And so it's a very short poem. And then there are other poems, other forms called tanka and haibun, many forms are there. So I love writing in all of those forms. And I've actually been teaching advanced haiku on an online site for the last, I'd say, 7 or 8 years. And for the last 3 or 4 years, I've been an associate editor of one of the journals called Haiku Katha, which comes from India. Mm-hmm. It's actually a very big, a very good journal, very prominent.
So haiku is also, the concept is popular in India as well.
So yes, it has really become popular now. Yeah. So because, it's accessible. It's small, 3 lines. And, unlike writing a sonnet or something where you really have to have, very good command over English and the rhythms and the chand and, all of those things. In haiku, you see something, you react to it, and you write about it.
Like, can you give us an example?
No, absolutely. So one of the most famous haiku from Japan is by one of the three great classic poets. His name is Matsuo Basho. So the poem goes like this: old pond, a frog jumps into the sound of water.
Beautiful.
It's so beautiful, right?
Yeah.
Every time, like,
and you can see the action, like you can visualize.
Yeah. And the sound of water. What a beautiful thing, right? Or there's another one by Shiki. It's you go, I stay, 2 autumns. You go, I stay, 2 autumns. So it takes, initially you look at it, you're like, "Ye kya hai?" But then you sit and you ponder it.
And it has to be 3 lines.
It has to, the most commonest form is 3 lines. Nowadays, people are writing 1 line and 4 line and all of that stuff. But
so the Japanese invented this Twitter, before the word limits and all, right?
That's right.
Or text messages, right?
That's right. Absolutely.
Excellent.
Yeah.
One question I want to ask you is, since the event honors the women in the industry, we have been doing it for the last 22 years. Actually, this is the 22nd year.
Wow.
And so I have to ask you, with your background, growing up in India, studying in India, then doing a PhD in the US, what is your take today in 2025 on the status of women? Where we are right
now? Honestly, growing up, so I'm from Kerala, although I've never lived there. We come from a matriarchal, society. So I never, growing up, felt like any way in a second.
No, matriarchal society. You mean in Kerala?
Yes.
In Kerala, it's matriarchal society.
The Nayars of Kerala follow a matriarchal society.
Okay.
Yeah. So, my grandmother was a very educated, very cultured lady. She spoke very good English. She was a swimming instructor, all kinds of things. My mother is a very, speaks like so many languages. She's an excellent cook. She can talk on any topic. So, I was never held back in any way as a girl, and even in college, I don't think I really felt in any way like lesser or not having enough resources or anything like that. There was never any question about if I wanted to study abroad, oh, you're a girl, you can't go, none of that. I think to me the saddest moment came actually, and I don't know if this is politically right or not, at this election, where I felt that so many women's rights were taken away. It just felt very sad. Your body was no longer under your control. Things like that made me feel really bad. But I think, generally speaking, I hope the world of women is coming up, but I think we still have a lot of long way to go. Yeah.
Somebody asked me that, what is your goal for the, you've been doing for so many years, for one MBA. And I said, the happiest day will be that when you don't have to do this event anymore.
Yes.
Because there will be no need. But I think, still long way to go. Although we have made tremendous progress.
Absolutely.
All over the world, but still there is a lot of stigma and a lot of struggle for women. Now, what drives you in life? Both in a profession as well as in personal life.
I think it's just curiosity and just actually enjoying whatever I do. I think when I was younger, yes, I was very ambitious. I wanted to definitely come to America. So I've been pretty lucky. So whatever I've wanted in many ways have happened. So I wanted to come to America. I came to America. I wanted to do a PhD. I did a PhD. I wanted to work in the field of memory and learning. I did. But then along the way, then I realized I didn't enjoy lab work. So then when I moved to industry, I really enjoyed the work over there. And just learning, different things. I love seeing overviews, big picture. That's what I enjoy about the work that I do now also, because, I see people, the facade that people show outside is not what's happening in their lives. So when you really talk to them, understand, the good deep history that we do, when we see a person for the first time, it makes you very humble, because people are dealing with so much. And and yet they function and they do well, and they take care of their families and everything, and it's very inspiring. So I really enjoy that. I really enjoy working with people. I really enjoy learning new things. I really enjoy learning something new about an acupuncture point, or about whatever, and I enjoy learning. So I think that's what drives me.
Very good. Surya, thank you so much for your time.
Thank you, Upendra.